All right. So thank you all so much for coming out to our monthly data forum. Our topic this month is health data and assessments, particularly community health assessments. So we're super excited that we have Tiffani from the Detroit Health Department who's going to share the 2024 community health assessment results. I don't think they've gone out anywhere yet. So really exciting exclusive. Um, we have folks from the Wayne County. I can never remember the full name. The Wayne County Health Department, essentially. Health. Nope, I'm not gonna get it right. I'll let Lucas say it correctly. Um, Katerina is having a baby, so she wasn't able to join us, but we're really excited Lucas is here to share results from the Wayne County Community Health Assessment. Um, and then we'll have Ally from Henry Ford Health, who they have not completed a recent health assessment, but she's going to talk about the hospital community health needs assessment process that they went through in 2022. And I always start talking about what is Detroit Data and what is the Go Data Commission. Um, so the Detroit Data is the open data catalog for the city and the metro region. We pulled together I think it's now 1,400 data sets from 7 different open data portals. And we also serve as a community data portal. So we have some 50 odd smaller organizations that are using our platform to publish data. And the Go Data Commission is a group that's pulled together as part of the city's government open data access for all executive order from 2015. And so it's a group of individuals, data experts, and community folks who are making sure that the city of Detroit is publishing open data and reaching people in their neighborhoods with that information. And with that, we'll have our 3 panelists. We'll have 5 to 7 minutes to present, talk about their work. We'll open it up to questions and discussion. And I'm going to hand it over to Tiffani now. And let me make sure you can present.
I don't have slides. It's just going to be off the dome this afternoon on this wonderful Friday the 13th.
Okay.
Okay. Hi, everyone. Thank you for joining this afternoon. I'm Tiffani Stewart. I'm the Director of Quality Management here at the Health Department, the Detroit Health Department, that is. Been here about 3 years, and we have been working on our community health assessment for a year, a good solid year almost to the date. So we're super excited. We've got our strategic issues hot off the presses. And while we're not ready to share just yet, I can share some of the preliminary highlights that we're seeing. We're super excited about being able to update our community health assessment and a post-pandemic landscape. Thank you. This is our community health improvement process right in front of you. We've adhered relatively closely to the MAP 2.0 framework and process. It's been our true north. We'll get into that here in a minute. But first, I need to start off with some acknowledgments. This work could not be possible without the generous funding from the Michigan Department of Health and Human Services. We were very fortunate to be able to use some of our SDOH hub pilot funding to complete this work. So I wanted to give a shout out to the Michigan Department of Health and Human Services. Our steering committee, I don't know if Ally is here, but she has been a part of our steering committee building out the direction for Detroit proper specifically. So I wanted to also acknowledge the steering committee. We would not have been able to get this work off the ground without their support. Last but not least, Denise Ferrazzo and our senior leadership team for their unwavering support as we move through this process. and the quality management team, past and present, including Sruthi Talori, Cecily Barnes, and Aduri Iwu. We have just put a lot of love into this work, and it is not for the faint of heart. I think I got 2 more minutes here. But what we have tried to do, because Detroit proper is nestled within Wayne County, we wanted to make sure that, yes, although there is intersectionality, there are some specific community facing issues that are unique to Detroit. So we just tried our hardest to just try to bring those things to the forefront. I'm happy to share some of those findings, as I mentioned before. Also, wanted to acknowledge my colleague, Dr. Shaka Bahadu, our health information officer. Wanted to also thank you for your support, your unwavering support and preparation for this afternoon's presentation. We are super excited to be able to lift up the voices of our community. As many of you know, our last community health assessment was published in 2018. The landscape is totally different, right? So what we have done, and I don't know if this was by mistake or, everything is aligned, but our partner, the Michigan Public Health Institute, I shouldn't have forgotten them. But they are our community partner, facilitation partner. So our community partner assessments, our community context assessments, they are all powered through the Michigan Public Health Institute. And I think this is going to be pretty key as we talk about some of the key questions on today's panel. We wanted continuity, right? So we are thankful for the partnership with Wayne County because we are all using the same contractor, if you will, and there will be continuity around the data that I don't think existed before. With Dearborn, they also facilitate their community health assessment, Wayne County, which is present today, and the Detroit proper community health assessment. So another feather in our cap is being able to build not only Detroit's unique story, but to be able to have continuity around the county because of the intersectionality. So that's my 3 minutes, and I will pass it over to the next presenter.
Hey, thank you so much. And will folks be able to find those results on this health department page once they are ready?
The results are not live. We just got our data briefs yesterday. So they will be forthcoming, but they're not published anywhere. We're just going to give a high level overview of our preliminary data today.
Yeah, okay. All right. We'll hand it over to Wayne County. Lucas.
Cool, thank you. Yeah, Lucas Ayers, quantitative specialist with Wayne County Department of Health, Human and Veteran Services, or HHVS for short, or Wayne County Health Department for short, also works. Dr. Katerina Stylianou couldn't be here today because yes, she's having a baby, and so had some follow-up appointments that she had to take care of today. I, just for background, work primarily in communicable disease at Wayne County. I've been with the county it'll be 7 years in August, but I have been part of the core team for our community health assessment, which we have also partnered with Michigan Public Health Institute or MPHI to complete. And I do have a brief slide deck if I can share my screen. Oh, yeah, I can. Okay, cool. Let me just go. Is it in presentation mode?
No, we don't see anything yet.
Okay.
But you get bonus points for the Detroit map on your wall.
Thank you. I did want to mention that I also have a Lansing and Kalamazoo map on the wall. If we have any Lansing and Kalamazoo folks here randomly. Okay. So just a little bit about HHVS, because it is a little bit of a unique jurisdiction for us here in Wayne County, just with Detroit having their own health department and being their own local health jurisdiction as well. So for the purposes of our public health and clinical care services, we primarily, well, we serve what we call out Wayne County. So which is all of Wayne County excluding the city of Detroit. So if you see that term out Wayne County throughout this presentation, or throughout our community health assessment, once that is finally published, that is what that is referring to. Um, and I should mention our community health assessment is not finalized or published at this time. We are still working with our steering committee for the final pieces of that, just as an FYI. So just a little overview. Obviously, the purpose of this is to understand and improve the health outcomes across Wayne County. This is the first time that this is being led by our Health, Human, and Veterans Services organization in partnership with Michigan Public Health Institute, and we are using the MAP 2.0 framework. If you're not familiar with that, that's the mobilizing for action through planning and partnerships. So there are three main phases: building the foundation, which is putting that core team together, as well as our steering committee, and actually conducting the assessment. And then telling the community story through assessments. So we did three primary assessments: the community partner assessment, um, our community status assessment, which is more focusing on the actual health status of the community, in terms of health outcomes, health behaviors, social determinants of health, systems of privilege, power, and oppression. And then that community context assessment, which is more so looking at primary qualitative data, demographics, conducting focus groups. And then that third phase is to continuously improve the community. A little bit about our structure. Our core team, again, is our Wayne County HHVS team. And then as part of our steering committee, we have representatives from over 20 systems and agencies within Wayne County. This includes hospitals, behavioral health organizations, veteran services, senior services, schools and childcare, as well as several immigrant and refugee services agencies as well. A little bit about our data strategy and analysis plan. We wanted to compare our indicators with not only Wayne County, but compare that to Michigan statewide and the US as well, to give us kind of an idea of where we're at in terms of state and national benchmarks. I'll get into data sources a little bit later, but we created a indicator matrix so that we could complete a gap analysis. Um, and then we are actually in the process right now of engaging our stakeholders and our steering committee to prioritize key issues and strategic areas based on this data. And then we will be preparing to build community-facing dashboards and reports once this is finalized, and then beginning phase three, which is our community improvement planning. So a little bit about how this in health indicators matrix was designed. We had our subcategory and description of the category, specifically what measure it was and what that data source was. And importantly, we wanted to know, was that data source able to be stratified by demographics, race, ethnicity, age, sex. Sometimes measures aren't able to be stratified. Which is fine, but we would prefer to have that data available to be stratified by demographics. Also important is, does HHVS have ownership of this data, or do we at least have access to this data? Sometimes that's not a possibility due to privacy and just access reasons. And so a lot of times we will have to make direct data requests to whoever does own that data, whether it's the state of Michigan or other sources. And then the importance to overall health of Wayne County. We consider, every measure that we kind of pulled to be important to Wayne County. But there is a little bit of strategy and prioritization that has to take place. And so our core team does have to decide what measures do we want to focus on in terms of their significance and impact to overall health of Wayne County. And then do we have trend data available? Ideally, 5-year trend at least. Sometimes we have measures that are available only for a single point in time. Do we have access to that data to create 5-year trend data if it's not readily available? And then we look at the data quality. for that measure? And then are there alternate measures that we can consider in its place? So a little bit about the data sources. We looked heavily at the BRFIS data, which is the Michigan Behavioral Risk Factor Surveillance System, inpatient database, looking at hospital discharges, MDHHS vital records, census data, county health rankings and roadmaps, which unfortunately will not be continuing after this latest iteration due to funding cuts. The MDSS, Michigan Disease Surveillance System, which is primarily what I work out of, EMS data, immunizations data, youth health, syndromic surveillance, overdose surveillance, and then a lot of those custom data requests to the MDHHS, like I mentioned. So these are key themes that have been identified. Again, these aren't finalized and these aren't our final priority areas or strategic issues that we've identified from the steering committee. But I did just want to show these as these key themes. We primarily group these into three buckets: behavioral health, health outcomes, and social determinants of health. Much of this probably isn't surprising, but these are the key themes that were identified across our the three assessments that I mentioned, our partner assessment, status assessment, and context assessment, as well as themes that were identified in our focus groups as part of the community context assessment, as well as focus groups from our partner surveys as part of that partner assessment. And then so our next steps are going to be meeting with the core team and steering committee, which has been ongoing and we're still in the process of reviewing these key themes identified and identifying up to 5 strategic priority areas. And then developing SMART-T goals to address those priorities. You may have heard of SMART goals, but we wanted to add the IE in there for inclusivity and equity. And I will put my just our general epi info email inbox if there's any questions, and happy to stop sharing and hand it off to the next speaker.
Excellent. Thank you so much, Lucas. And then our final presenter is Ally with Henry Ford Health.
Thank you. Okay. Hi, I am Ally Rooker. I'm the manager of community health impact at Henry Ford. So I manage our community health needs assessment, or CHNA process. And I'm just going to talk a little bit about what that process is, what the requirements are for nonprofit health systems. This requirement for nonprofit health systems comes from the IRS. It is a piece of the Affordable Care Act that says nonprofit health systems seeking 501c3 tax exempt status must conduct a CHNA every 3 years and then adopt an implementation strategy to address the things that rose to the top of your community health needs assessment. And here's just a high-level overview of what that process entails, the required elements. You define your target communities, do the qualitative data collection, analyze the needs, prioritize those needs by hospital, get your board approval by a governing body of the hospital, post it publicly, and then develop the implementation plans. And where Henry Ford is currently at in this process, our last CHNA was in 2022, so our next one will be due at the end of this year. So for Henry Ford, our target communities is any county in which we have a hospital, which I have a list of in a couple of slides. Our data collection for this round of our CHNA, we're actually partnering with 2 other organizations. We're partnering with Oakland University for primary data collection through focus groups, interviews, and surveys with community members. And then we're partnering with SEMHA for secondary data collection. And that is from, census data, state and local level data, all a wide range of encompassing health needs. We don't focus in on certain areas until we do the prioritization. And then we prioritize need by hospital, weighing the primary and secondary data, and also what the health system has the capacity and the ability to address. And then we move on to the implementation planning phase, which is required to be publicly posted 6 months after the CHNA is due. So our implementation plans will be due next May 2026. And these plans outline strategies that will be taken over the next 3 years to address the priority areas of need that we highlighted in the CHNA. And this process, there is no accountability of the implementation plans, like the data updates, things like that, to the IRS, to the government. It's all just internal accountability to our Henry Ford governing structures. So here is the list of the landscape that is covered in our CHNA. Some of you might know last year in October, Henry Ford underwent a joint venture with the Ascension Southeast Michigan hospitals. So we have expanded since our 2022 CHNA. We have gone from 5 to 13 hospitals. So we are now in Wayne County, Oakland, Jackson, Macomb, Livingston, Genesee, and St. Clair County. So we have quite a bit bigger scope for this CHNA compared to the last one that we did. And just to show you what we prioritized in our last CHNA, how we've done it, at least since I've been involved with this work, is we have two system-wide priorities that all of our hospitals share. And in 2022, those were chronic disease prevention and management and behavioral health and substance use disorder. And then for a third priority, each hospital chooses something that they want to prioritize that can be specific to them. And in 2022, the Detroit Hospital and the Jackson Hospital both chose infant mortality, and our other three hospitals, Macomb, West Bloomfield, and Wyandotte hospitals, chose cancer prevention and screening. So we think we're probably going to take a consistent approach for the 2025 CHNA, where we know we will have consistent priorities system-wide, but we may also look into kind of an option of an additional priority per hospital if they want to, go outside of the system-wide priorities as well. And then just how our CHNA process is working now. All of our 13 hospitals are going to be included in one overall CHNA. We break all of our data down by county to show the need in each hospital area, but it's all in one collaborative CHNA document. But there is two hospitals that have their own local collaborative CHNAs as well that operate outside of the Henry Ford CHNA, but those hospitals are still included in our document, and that is the Genesis Hospital and the Jackson Hospital. So the Greater Flint Health Coalition does a collaborative CHNA with McLaren and I think, what is the other hospital? Maybe Trinity Health. And then the Jackson Health Network does a collaborative CHNA that is with the Jackson Hospital and with a bunch of community-based organizations. So they still maintain those separate operations as well. And then the CHNA work at Henry Ford is managed by my team, the Community Health Equity and Wellness team, working with leaders across the system in the content areas, in the priority areas that rise to the top of the CHNA. And then these are all of the regional health committees, I believe, a comprehensive list that Henry Ford kind of has its hands in, has a representative on when we're able to make sure that we're trying to align with all the efforts that you all are doing as well, all the health department groups, all the other hospital groups. If I'm missing one and you think we should be involved, please let me know, because I feel like this list is always changing. And then again, our CHNA has to be publicly posted. So this is where you can find it in the Henry Ford Community Health section. You can find our 2022 CHNA and the CHNAs before that, and then all of our implementation plans and the CHNAs and implementation plans that were part of Ascension before we did the joint venture. And that's all I have.
Thank you so much. These are really intensive efforts, I know, across your different organizations and teams. So, and Ally, I think, with the Henry Ford expansion, it's an even larger effort than previously. So great to see all those kind of across, I don't know what to call it, cross organizational and municipal collaborations. Yeah, so now is our time where we can open it up to any questions. I think one thing that I might ask Tiffany first is if you guys can talk a little bit about your data collection process for the 2024 Community Health Assessment.
Sure. As Lucas mentioned, we're about, just for context, we're about, I would say, 3 to 6 months behind our friends in Wayne County. So we were able to be a fly on the wall. So as we talked about continuity, we basically just got right into the community, right? So Detroit proper is divvied up across 7 districts, right? So and last year, about April, we launched our community health assessment data collection in alignment with our Public Health Week. And we just got into the community. It was not rocket science. We aligned and created synergy with our public health programs. And we hit the streets, right? So a survey, Alchemer was our survey method of choice. Community outreach. And it took us about, I guess, 9 months to try to get some primary data that we could actually be proud of and actually start building out our community context assessment. So our quantitative data was launched again last year, 2024, seems just like yesterday, in alignment with the work that we're already doing. This work could not be completed without the community, without the steering committee, without the continuity, but Detroit has 7 different flavors. So the team, myself, we went in, again, partnered with our public health programs, anchored our outreach efforts with our steering committee. So that was another feather in our cap, being able to bring back the voice of not only the community, but the community-based organizations. And then we went into our community context assessment, right? Our focus groups. That is really got good for me and my teammates. We were really able to hear more intimately about some of the things that were plaguing our community. So to start, just old school community outreach coupled with some most social media campaigns. We learned a lot about social media. We did some partnering with our academic partners as well. Our practicum students also helped us to fan out the word. So hitting the streets, social media campaigns, partnering with the community-based organizations, sticking really closely to our steering committee, using the power of MPHI to really flesh out the pain points across the districts. We really wanted to be intentional in making sure that every voice across the district had the opportunity to be heard. So our quantitative, our qualitative, we just moved into our strategic data briefs. We'll be going into our community partner assessment. That was also a key component into understanding how we would build out our community health improvement plan, which is next up for us.
Great. Yes, thank you so much.
So,
Oh,
hi, my name is Lisa Perry, and facilitate the Wayne County Oral Health Coalition. And this is a lot of good information that was given, but I didn't hear anything about oral health. We're not collecting any information about oral health that really do improve overall health. And so I'm really interested in meeting you, Tiffany, from the Detroit Health Department. We're been out in the field doing oral health education, connected to state and federal oral health organizations. And so I'm here to offer my services and also offer the services of the people that support the work that we do. So if we could do that, this time was well invested for me to be here.
Sure. Thank you so much for that feedback. We do have gaps, and we can talk about that during our Q&A, but there are gaps. Oral health, we did get some secondary data around dental visits, but we will welcome you to the table, and we can continue to try to build that out a little bit more comprehensively. But yes, there were some gaps in our survey methodology, and we did hear feedback from the community that we needed to close those gaps. So the next iteration, as we bring additional partners to the table, as they become aware, you are more than welcome to join us on this journey.
Great. We're making connections. All right, we've got a question in the chat for Lucas. During the piece about Matrix, you mentioned data quality. Interested in what is methodology tools used by your organization to assess data quality?
So it really was, it really was a larger piece of that matrix. Like all of those factors we kind of used to piece together data quality and alternate measures to consider was kind of at the end after we looked at all those other various sub indicators for that measure. And so, uh, is it something that we are able to readily access? Is it something that we're able to replicate if that data source were to go away, which we have seen a lot as of recently? And that also goes into our ownership and access of the data as well. Is the data able to be trended? Is the data able to be stratified by demographics? What is the source of that data? Is it a secondary? Is it a primary source? Where if it's a secondary source, where are they getting the data from? So all of those pieces went into that for us determining whether that met what we needed it to for that indicator, or if we needed to consider an alternate measure.
I think maybe a question that we've got on our list kind of goes along with that is, a lot of our health data that is available is tied in with hospital reimbursement coding. And I know, that's often a great source of data because it exists. But I don't know if any of you can speak to, kind of the benefits, the pitfalls of um, relying on that kind of data.
For us at Wayne County, it's first you have to have access to it, which again was part of that goes into that indicator matrix as well. And so a lot of that data we would get from the Michigan inpatient database, which we, to my knowledge, do not have direct access to. And so we relied on any hospitalization data that we were relying on. Were primarily MDHHS data requests or requests to the Michigan inpatient database folks.
Yeah, I know SEMHA and MDHHS are usually pretty helpful for access there.
And I do just want to add, and when we're submitting MDHHS data requests, MPHI has been a great partner as well on our behalf in terms of submitting requests as well with contacts that they have at the state.
Hello, folks. A quick question, and I probably missed it. I'm an older man now, so I'm not always hearing everything. But what about the Medicare and Medicaid data? Are you using that at all for hospitalizations and reimbursements? Just piggybacking off of Alex's question. And how useful is it?
I can speak to a few things that we use Medicaid data for, specifically asthma hospitalization data for children
Okay,
is primarily what we use that for.
got it.
It is also a ownership and access issue, and that's a data request.
And Medicare too?
So Medicare data, we
I don't think anybody can get access to Medicare data.
yeah, I don't recall us having access to that or utilizing that in a significant way as part of this.
Interesting.
I can look into that.
Okay.
And I was really just thinking of that question, the pitfall is we're trying to capture community health, but we just look at data that hospitals are collecting, and that just gives us a very small window into the health needs of our populations. Um, which yeah, I guess I don't know, maybe Ally, are you able to speak some more about I know you said you guys are going to start doing some primary data collection. What kinds of things will
Yeah.
you guys be looking
Yeah,
for?
so actually, with our primary data collection, that Oakland University is partnering with us on. So this CHNA cycle, the Michigan Health and Hospital Association, MHA, has um, kind of started a new push to make a more of like a collective impact with the CHNAs with their member hospitals and kind of not instructing, but like encouraging the prioritization of chronic disease, mental health, and maternal health, which have been amongst our priorities at Henry Ford for the past like 8 years. It's not like a new thing, but they want collective impact around those three things. So in our primary data collection, we want to really go deeper on those topics instead of what we've done in the past, which is kind of providing more of like a laundry list of health issues and social issues and saying which are the most important ones, what's the highest need, where do you see the most, intense need in your community. We want to go deeper on chronic disease, maternal health, and mental health with our primary data collection, and more asking like, what resources could a health system provide you that would help in these areas, or like, what would you like to see a health system do to improve things in these areas? Because I think, primary data collection is really important, but we do kind of always hear like the same things. Like it's the economic needs, it's the social needs, the health things that always come to the top are chronic disease, substance use, mental health. So we're hoping to kind of more get people's opinion on like, here we know these are the issues, but like, what do you want to see us do about it this time? And hopefully that will help more with our like implementation planning when we get to that step, to be more focused in what we can put in those plans in responding to what people say.
Anyone else I want to make sure we have space for any questions from folks who have joined.
I'll jump in to piggyback off what Ally
Yeah.
said. The primary prioritization, none of this is new, right? You get the same cast of characters. But one of the things that rose to the top for us in Detroit was environmental justice, right? This was not on our bingo card, but the community really was vocal about making sure that the Detroit Health Department responded to environmental justice, not only in Southwest Detroit, but it is a widespread problem around our community. We talked at the top of the call about intersectionality. So the same air that Detroiters are breathing is the same air that people in Wayne County are breathing. So creating synergy and response around addressing asthma, for example. So we talked about, again, environmental justice, mental and behavioral health. That's not new to any of us on the call. We also have to align our response as a local health department to meet the needs of the community. So one of the things, and I'm going to segue into the next question, and just forgive me for that, but the making things better in your community, it has to be aligned, right? It has to be aligned. You have to align resources, data. We need our health system data, right? We need Henry Ford data because that's where some of our residents, there's just all types of intersectionality. And I think another key feature of being powered through MPHI is asset mapping. We know that there are tons of shuttered venues. The landscape just doesn't look the same. Community-based organizations have different leadership. There was a huge human component to driving some of this change before the pandemic. So it was and then another key component that came out, and like I said, this is hot off the presses, but when you're looking at environmental justice, for example, poor waste management. There are some low-hanging fruit and some things that we can address outside of the norm, right? For us at the health department, as we were going through and continue to go through our data briefs, again, none of this is new, but it does give us some indication of how we can bolster our programming, right? The programming that we have, we're continuing to go outside of the walls because of the change of the landscape. This is really critical for us to make sure our neighborhood wellness centers are meeting the needs across the 7 districts, right? We're making sure that our PSAs and all of our public health priorities in-house are being aligned with the needs of the community. So I just wanted to interject that in addition to the typical cast of characters, there's been a huge cry in our community around environmental justice.
And I would just echo Tiffany's comments. That's something that came up that was one of our key themes identified as well, was built environment and environmental justice. So definitely seeing a lot more focus on that area as well.
And I think that's a great segue. We're in a data forum, and I guess where do you all see data playing a role in helping advance some of these key issues that the community bring up, or how does data help us move towards those solutions?
I'll go first. I'm a lean practitioner, and if you cannot see in front of you, you can't help, right? So data being shared, I'm going to go back to continuity, being able to have the opportunity. Ally showed how Henry Ford has created synergy with local health departments. We have to be speaking the same language, right? So the opportunity for forums like this, making sure that our data teams are creating synergy, again, around Just Air. We had a lot of learnings about programs. There's a lot of duplication of efforts, right? If we can use this data so that we can see the landscape, so that we can see the viability of community-based organizations being led by our steering committee, I think that is the foundation. You have to be able to see, and data, quite frankly, allows you to be able to do that, and it allows you to do a pretty succinct alignment with other resources in your community.
Okay, if I may follow up quickly with just piggybacking Tiffany's comments. Just in the same vein, another thing we are trying to do is to provide resources for both the residents of Detroit and other stakeholders. We have just built an EPI dashboard which is public facing, which people can see the basic health profile of the city of Detroit. and they can see what are the prevalences of health conditions and show trend over the years, so that people will need these for any purpose, maybe research or policy, or just curious residents could see this data and make decision. And we're also looking at getting feedback from the users to see what other things we should be incorporating, or what other things are redundant, and then keep revising this. And so I think, just like Tiffany said, data is so critical, is so very important with all we do. And we are not just doing it in isolation, we are partnering with other people like like the Wayne State University, like the University of Michigan, on a number of projects, and some other initiative like the Phoenix Data and all that. So yeah, so we're trying to provide these resources both for internal and external stakeholders. Thank you.
Thank you.
Yeah, Alex, just I wanted to address your question, and I know this is like the third person from the health department who's talking at this point, so I'll keep it brief. But essentially, it starts with we have to understand what our metrics for success are. We have to define what success in public health for our community actually is, and whatever it is that we use to define that, it has to be something that we can measure, right? That's where we have to start. The data that we're collecting, I'm assuming, it has a through line to how we have defined success, right? Data ultimately drives strategy, right? Which in turn drives an operational plan, which in turn drives outcomes, right? Or impact, right? So long as we are able to measure at the beginning, right, with these assessments, and then create a strategy and drive the implementation of that strategy, and then measure the same metrics for our impact, that's where it is. That's the through line, right? And that's what we aim to do.
Great. Yeah, Lucas or Ally, want to talk about the importance of using data to advance these topics? Yeah.
Um, yeah, I mean, I would echo what our partners at Detroit Health Department said. And something that we're really working on at Wayne County is making this data more accessible and getting it into the hands of the actual public. And just a few programs and projects that we're working on. Again, going back to like built environment and environmental justice, is our partnership with Just Air and the creation of the Just Air dashboard and Just Air app in Wayne County, especially today and as of recently with Canadian wildfire smoke. That's really just becoming a prominent issue. I remember the summer of 2023 when it first happened, and we started getting all these calls, and especially from schools about what to do. And we really, that wasn't something that we had experienced before here. And so trying to find resources in terms of what can you actually do to keep yourself safe and your family safe, your pets safe, when we have these type of events. And Just Air has been a great partner. We have a large air monitoring network now, operated by the health department in every community in Wayne County, Detroit and out Wayne, and providing real-time alerts that the residents can actually sign up for. We also do quarterly community presentations, looking at the data for that most recent quarter, giving that back to the community. And then we recently, Wayne County is not a very large beach destination, right? But we do have some public beaches, and we have restarted our freshwater beach monitoring program in partnership with Wayne State for this summer. which is also really important. Water quality, air quality, where people are spending their time. And we want to make sure that people are safe when they're swimming, their pets are safe. Um, uh, we're also looking at utilizing syndromic surveillance in a greater fashion for both weather-related illnesses, so think heat-related illnesses, cold-related illnesses, but also carbon monoxide poisonings when those events happen, if people are losing air conditioning, and that can help us make decisions on are we seeing heat-related illnesses more prevalent in these communities? Do we need to focus on identifying cooling centers in that community? So really just using all of that data and all the resources that we have available to us and getting that data back into the hands of the community and our decision makers. Um, uh, to make everything more accessible and actually useful for people.
From the health system perspective, the nonprofit health system perspective, I would say the data is really important getting buy-in from health system leadership. This process, the CHNA process, is a completely unfunded mandate from the government. So, we have to do it, but there's no mandate that we have to do it particularly well. You can really just check the box and make sure you don't get your tax exempt status revoked by the government. But I think showing hospital leadership the data that you all collect in your community level and your more like health department level assessments is really important because I think you're you're showing the impact of like the efforts of a health department, which is like so community based. The efforts of a health department are inherently so like individual patient based. We're not really able to look at the impact on the entire community of what we're doing with just serving individual patients. So to like see the impact of your data year over year, over time, with like you can see the changes in infant mortality, you can see the changes in chronic diseases, and so then you can like make a better case of we should put more resources into our implementation plans because look at the impact you can have globally over a long period of time. But without that data, it's really hard to get that investment of we should put all this money into things that are kind of like extracurricular. They're not just what we put into an individual patient. They're more global. They're a little harder to see what the actual impact is because it's not coming through in like a Frescani score or, a patient satisfaction and all of those things. So the data that you all have, I think at like the community level is so important for showing the importance of like what the impact of this work can be.
Yeah, that's great. Thank you all so much for answering that. I think that's a perfect question to end on, unless there's any other questions from the group. But yeah, it's really great to hear that you all are thinking of the ways that you can use this data to help either inform community members or inform community activities. Um, I'm gonna make a quick pitch for our next data forum, which we're going to do our first hybrid option. So we'll be downtown at the Urban Tech Exchange, as well as on Zoom. So you can still join virtually if that works best for you. But really excited. We'll have the Office of Sustainability and Joy Southfield, CDC, as well as the East Side Community Network represented, um, talking about a lot of the work that they've done around clean energy and clean energy advancement in the city. And otherwise, thank you all so much for joining. Shout out to the Detroit Health Department for bringing the whole team. Lucas, thanks for filling in. Excellent to hear about the Wayne County process. And Ally, thanks so much for sharing. I know the the unfunded mandate expanding as you guys expand the health system. But super thankful for all of you for sharing your knowledge today and sharing a lot of the really great health data resources that are out there, especially the ones from each of your organizations.